Hi, everyone. This is Suzanne England and Sarah Norton from the Gatehouse Media HR and Wellness team, and we're very pleased to have Dr. Crystal Jenkins with us today. Dr. Jenkins is a primary care provider, a family physician here in Rochester, and we're very excited to have Dr. Jenkins here with us today to talk about weight loss and preventative care. They're very closely related, and of course, at this time of the year, folks are, primarily interested in improving their health, which is great. And weight loss, managed correctly, can be a great way to actually improve overall health and wellness. So we're looking forward to some advice from Dr. Jenkins. To kick it off today, I'm just going to ask Dr. Jenkins to talk a little bit about herself, and then we'll get into some specific questions that'll be really helpful for you in informing your strategy.
Great. Well, thank you so much for having me today. I'm really excited to be talking about a topic that is just so important for overall health and for any person's success with regards to their health. So I am a family physician. I'm originally from Missouri and did my medical school at St. Louis University and came to Rochester for my training in family medicine. And really, the family medicine approach is really about whole person centered care and really approaching somebody from understanding them as who they are as a person and not just their diagnoses or their, the measurements of their health statistics. And so coming at it from that approach, I think helps tailor any discussion about weight loss to an individual's particular situation and needs. And so I may come back to this point as we go along. A little bit about why it is so important to have a primary care physician. It really comes down to so that you have somebody trained in healthcare who knows you. When you go to the emergency room or an urgent care or even a specialist, you're there for a very specific reason, and there's not usually the approach of trying to understand you in the context of your work or your family or your nutrition. But a primary care physician really should, especially if you meet them more than once, this should be a longitudinal relationship that you develop over time, so that person really is your go-to for any health issues, anything that you want to tackle about your health. And if you have chronic health conditions, of course, they're going to be your number one go-to. And if you don't and you want to keep it that way, then they are the perfect person to start a conversation with about health and wellness, and whether it's tackling quitting smoking or improving your diet or implementing an exercise plan. All of those can be tailored to you, and this primary care physicians have a pretty wealth of knowledge in lots of different topics, and they usually know the resources in your area of how to connect you with further services such as a nutritionist or other types of services that may help you be successful in setting your goals and meeting your goals.
So, Dr. Jenkins, why is weight loss important?
Well, so it depends on if you are overweight or if you actually meet criteria for obesity. And I will start by saying, there are about 70% of adult Americans do need to lose weight. So probably about a third of people or a little less don't need to lose weight. And then weight loss is not important, but weight management, I would say, is important. So for for 2/3 of Americans, weight loss is such a crucial issue to tackle because it has such vast consequences down the road. When you carry extra weight, your risk of developing various types of cancers is very significant, even to the point that it almost is as bad for you as smoking. The wear and tear on the joints, the back, the knees, the hips, is also so much so that it really can put people into a debilitated state, dealing with pain and immobility. It also leads to chronic health conditions like diabetes and high blood pressure. And so, most people know this, but they don't know what their individual risk is really until they go to the doctor to find out, well, what is my blood pressure? Or is my blood sugar starting to run high? So many people can go through life, or, especially the earlier part of their life, carrying extra weight and not understanding that it is a really important thing to try to address before it's caused the problems.
And why is belly fat in particular dangerous?
Yeah, so this is something that I think, is still being studied and trying to understand it. But there are certain people who, when they gain weight, especially women, if they put that weight in their butt and their thighs, it's actually not as dangerous to their health as is when people gain weight and they put it in their belly region. And what that means is that fat not only is in the belly where we can see it, but it's also inside the abdominal organs. And so when fat is getting distributed in the liver, around the intestines, and in other all throughout our organs, that can actually have really severe consequences in terms of the health. Now, one thing, and this is a very specific example, but people who carry extra weight in the belly region can actually develop a really pretty severe condition called steatohepatitis, and it's an inflammation of the liver, and it's purely due to fat that gets deposited in the liver. So, particularly people who are eating very high-fat diets, particularly processed fats, like let's say fast food, this is a condition that can develop, and really the only way to reverse it is to stop that fat deposition and to lose weight. So belly fat really has a lot of severe complications down the road. That's one example, and diabetes is the other biggest one.
That's really good information. Do you have any tips for setting realistic goals to achieve sustainable weight loss? I think a lot of people, I know, even for me, that it's really easy when you start to embark on a program and you start to see immediate results and it's exciting and you can stick with it, and then you move into a phase where either you want to maintain or your results sort of slow down, and that can be a little bit hard then to sort of stick to it.
Absolutely. And this is such a common time of the year to be sort of examining ourselves, our habits, things that we want to improve about ourselves, because, really our long-term success depends on us doing this process. And so even though it is such a, sometimes people might say it's kind of corny to set, New Year's resolutions, I actually think it's a beautiful thing, because even if something doesn't last the whole year, at least you started that, and maybe you circle back to it, down the road. So I have so many tips, but really, the first tip is just to start very small. And, lots of people say, oh, I'm going to do this, drastic, change in my life that, it doesn't take long before you realize that's going to take a lot of energy and a lot of time, or lots of room to mess up, so to say. And so then people lose hope, say, okay, well, I already failed, so I'm not going to do anymore, and just go back to what they were doing, and sometimes even worse. So that setting up for failure is one that happens when people set unrealistic goals. So I like that you focus, the first and foremost is setting something that's realistic, and what's realistic is something that's small. And so again, as I customize all my discussions with my patients, I start with, well, do you drink soda? If the answer is yes, that is almost always my first place to start. Because if you can address the sugary beverages, then you can work on, well, what else, what are you eating, and what else can we change? But soda is such a potent dysregulator of metabolism, and just leads to such poor health, that if we can start there, that's usually something that takes a year in and of itself to make a significant change. If somebody really is a soda drinker, eventually being able to cut that out of their life makes all the difference. And then we can start and go from there. And of course, the other aspect is movement. So realistic goals for moving more and exercising is something that a lot of people struggle with. They don't know how to go about it. They don't know, how will I incorporate that into my schedule? How often can I go to a gym? Can I afford to go to a gym? If I can't, how do I do exercise at home or in my neighborhood? And so those discussions can be, pretty detailed, but the bottom line is just moving more. And you don't have to go to a gym or be an exerciser just to move. And so, things like my neighbor this morning decided to shovel his entire driveway by hand because he said he needed the exercise. And it wasn't heavy snow today in Rochester, so that was the good news. But, he was out there for about half an hour, so that's his 30 minutes of exercise per day. So it doesn't take much as long as you're willing to just move. And when we are afraid to move or we get into that pattern of not moving, that's when usually the extra weight sets in.
How can weight loss affect your overall well-being?
Oh, well, just in so many ways. And I think, it comes down to not just the weight loss affecting your well-being, but it's also the strategies that you're using to get to that weight loss that generally lead to people feeling better. So if all of a sudden they're drinking water instead of soda, you feel better. If you're eating nutritiously, you feel better. If you're exercising, you feel so much better because all of these things have been shown to boost our natural brain chemicals that lead to feeling happy, to feeling well. They can improve your sleep. When you're sleeping better, you feel great. And you actually are thinking more clearly. And so all of those things, related to really great nutrition and exercise and movement, lead to feeling better. And then just the, general sense of feeling like you look good, that can go a long way. Just feeling that confidence that comes with, knowing that your body is in a healthful state, really is a great one.
And I know one of the things that you and I have talked about in the past is that there are also improvements to things like certain skin conditions and, musculoskeletal issues, potential back pain, neck pain, when you're not carrying that weight.
Absolutely. Taking fewer medications even. I mean, right. So the what could potentially be affected, depending on some individual situation, can be great. Exactly. If somebody can take a walk around the block and not have that pain anymore, that does wonders. If they can participate in, playing with their grandchildren again, that gives such a, improvement to their quality of life. So, depending on what somebody is dealing with, almost always some aspect of their life is going to be better, when they're achieving their weight loss goals.
That's really helpful. Are there some barriers to weight loss that you might be able to help outline for us so that we have it right out on the table so as our, folks or employees that are looking towards this goal, at least have a way to think about, okay, what they might be, and then you can kind of try to plan around it.
Absolutely. So, the barriers, there's plenty of them, but I think the most important one to address is the barrier of our own mind. Our own thoughts about what we can and cannot do is oftentimes the most limiting thing in any change that we want to make. So we think, oh, there's no way I can go to the grocery store and not buy that thing that I love. And so the barrier is overcoming that mental hurdle and breaking the habit. And so habits really are a barrier. And those habits, come from oftentimes from, the way we were raised. From childhood, we've developed certain habits around food and around how we structure our daily lives that includes or does not include movement. And so the barrier of changing habits really starts with that mental approach. The next thing that becomes a barrier are sort of the day-to-day logistics of implementing any type of change that you want to do. So let's say you have to drive somewhere, or you have to rally some help in your family or your community to make a change. Then that can be a barrier. And so you want to talk through it with people to try to get a little bit of, one, somebody to be accountable to, and two, somebody to sort of help you on a journey of trying to change a habit. And then, of course, there's, I think for many people, financial barriers feel like a big one. A gym membership, that feels like a big change when people are talking about, well, how am I going to spend, what little extra money I have each week or each month on something that, I don't really want to do anyway, and maybe I'm not even going to like it, and how that will be. So I always say, if people are, if that's the place they're coming from, don't think that that's your only way. There are so many things that you can do that really are free, or almost free, in terms of incorporating movement and exercise into your day. Vacuuming is one of my exercises, and if you have to clean your house, then you have to move. And so it's all about the intention that you bring to whatever type of activity you have to do, whether or not you can do it with enough speed to get your heart rate up. Most people can do any number of things and get to that 30 minutes a day of physical activity, even just in their daily routine. The speed with which you walk makes a big difference too. And then, when it comes to cost at the grocery store, that's another big barrier that people can feel like is I just can't make this change because they're telling me these organic things, or these, going down the healthy aisle is what I have to do, but these things are a lot more expensive. And so really what it comes down to is finding the inexpensive, highly nutritious foods that I can still make taste good and incorporate into my routine of serving meals. And the tricks almost always are beans and frozen vegetables. So beans are such a highly nutritious, highly beneficial plant-based protein that you can incorporate into almost any meal. And truthfully, going to a plant-based diet, you don't have to label it vegetarian, but certainly less meat almost always costs less, especially if you're making things from yourself. And so, these types of things like beans and other legumes, like lentils, are very inexpensive. They're easy to cook. I get canned beans myself because the dried are just that's a process. But it's just such an inexpensive protein source that has high in fiber, tons of micronutrients that your body just loves. And then produce is expensive, and if you don't use it quickly and it can go bad, it feels like a really big waste. There's sometimes a fair amount of prep work that goes into planning a meal that has a lot of vegetables in it. But in Rochester, we're lucky enough to have a store called Wegmans. And Wegmans is all about their veggies, and they have lots of different frozen vegetable options that have even sometimes a little seasoning, a good blend of things. So all you have to do is just dump that bag in a pan, warm it up, throw your other ingredients in, and you have a meal. And so that usually the frozen produce items are much less expensive than fresh, and of course they're available all year round. And then if you don't get to them for 2 or 3 weeks, that's just fine because they're protected in your freezer. So those are my tips for overcoming some of the barriers that can come up with weight loss.
That's very helpful. I think one of the things that we haven't quite touched on, but is a significant barrier to weight loss, is emotional eating. And, certainly our employees at Gatehouse, when we did, a survey in regards to health concerns, the biggest concern that came back, was stress. There wasn't any information related to, stress and nutrition, but it's a natural kind of ebb and flow that can go together. So that feeling of stress and anxiety and, reaching for something that's salty or sugary or combines the two to just provide a little bit of comfort or a little bit of an outlet. And so just wondering your perspective on emotional eating and just any strategies or little tips that you might have to help manage this, because certainly it's, everybody works really hard at our company. Folks have very busy lives outside of work with families, and just other commitments, and, it can be a real issue.
Absolutely. No, this is such an important topic. And, the hard part about answering this question is the solutions don't come in the form of, well, what food can you eat when you're stressed that's healthy? The answer comes in addressing the underlying emotions that we're not necessarily always equipped or comfortable with addressing in, non-panic mode. And, so talking through our stresses with our loved ones, with, professionals, and with, our, other people in our lives to try to address the root cause. What is it that's stressing me? And if it's, time, coming at it from a time management strategy can be helpful. If it's, depression, then, naming it and coming up with treatment solutions for depression is a really important thing. If it stems from, deep-rooted, unhealthy relationships with food itself, that's another, aspect that you have to come at that with a little bit different approach as well. And there are groups and professionals out there, ready and trained to address those types of issues. And then it just comes down to what, if it's just basic stress that, you happen to be standing at the freezer at night and you grab that pint of ice cream, coming up with ways to avoid doing that too much. And, and then it's sort of about, okay, how do I go through my day and set myself up for having a relaxing night, kind of finding out, okay, well, when is it that I'm having these types of urges or these cravings, and how can I avoid having them too often, and having ways that I can soothe myself other than with unhealthy foods. So maybe you have a cup of tea, maybe you set your bedtime a little bit earlier so that you're not having those midnight, cravings, because you're actually getting restful sleep at that time of night. I actually don't know that we're going to have a chance to talk about this again, but so I want to bring it up now. There's actually a large body of evidence growing that sleep dysregulation can lead to obesity. And so, when you're tackling nutrition and exercise, it's also really important to talk about sleep and your sleep habits, because it really does all tie in to one's wellness, of course, but even just to their weight and their waistline. So emotional eating is, I think we all do it. Anybody has had the circumstance of feeling stressed and having a piece of candy and they immediately feel better, right? You have that sugar high, and, food affects our emotional selves. It affects the way we feel, both physically and emotionally. And so recognizing that that's not something we're going to ever get rid of, but it's something we can learn to approach with, a healthful, open eye, and, avoiding it or saying, or just, I think anytime somebody is trying to ignore, especially negative emotions, that's when you're at risk of kind of falling into these, repetitive, unhealthy, emotional eating, maybe binges. So look for resources, but again, I can't emphasize enough, the importance of, talking and having a primary care physician and then talking to them about it, and so that you can work through your particular hangups.
Thank you. That's really helpful information. So a couple of things. We will move and see if there are any questions from any of the audience members. If you go to the link on the webinar, there's a chat function that you can send a couple questions in, and we'll take a couple questions for Dr. Jenkins before we close. One thing that I wanted to remind our employees in regards to is that we do have an EAP program, and so please feel free to reach out to EAP. Your local HR representative has that information, and that can be a great alternative to emotional eating, is to reach out to somebody and talk through concerns that you might have, or things that you might be feeling and want a little bit of help with. In addition, as you can see, weight loss is very much supported by having a primary care physician, having a family doctor. So if you need a family doctor, please feel free to reach out to Touch Care. If you are on the Excellus Blue Cross Blue Shield plan through Gatehouse, Touch Care is very skilled at helping you find any type of physician, whether it be a family physician, an internal medicine specialist, which is basically the terminology for sort of adult primary care, in addition to any other doctor or provider for help that you might need. And Touch Care can be reached a couple of different ways. 1-866 Touch Care is one way to reach them. And they provide a great service. You can also, one of the easiest ways to get a hold of them is via email, and their email address is, hold on one second, I'm just going to pull it up. Touch Care. So it's Touch Care, hold on one second. We're just waiting for some questions to come in anyways.
You know, just while she's looking for that, oh, did you find it?
No, go ahead.
There were a couple of other things that I was thinking of in terms of, you know, I think just strategies that people will come up with that really can be very helpful. And, you know, one of them, and I don't, you know, purport that any brand over any other brand is beneficial, but a program such as Weight Watchers, you know, anything that has some structure and accountability to it really can you know, I've seen lots of great success with programs like that one, but there are lots of other ones out there, and any, you know, whether it's an online community that you, you know, try to, you know, find connections with, there are actually some really pretty cool apps out there, you know, on your phone or your computer that usually include food logging, exercise logging. You know, there's tons of wearable technology this day and age that, you know, tracks your movement and your steps and sort of helps you set some, you know, small goals, or, you know, kind of check in and see how you're doing and things like that. So all of those can be really useful tools in, you know, in your journey.
That's great. And so that email address, I apologize, gatehouse@touchcareassist.com. So it's gatehouse, all lowercase, @touchcareassist.com. So we have two questions.
We have a few questions. So one of the first questions is, what are some small, realistic goals?
So you know, there are so many, and, you know, I'll list, you know, maybe a half a dozen of them, and then you pick one. You know, the best small realistic goal is the one you're going to do. So if you set one that even to me seems small and realistic, but to you it seems insurmountable, we'll start somewhere else. So, you know, the first small realistic goal is don't drink soda, or don't drink juice, or both. So cutting out sugared beverages is really the number one recommendation I can make to anyone who's trying to improve their health and lose weight. Two is get more fiber. Anything that has fiber in it generally is going to be improving your overall nutritional status. So things like beans, whole grains, vegetables, of course, and whole fruits. So not juices, but a whole piece of fruit is much better for you because it has the nutrients in their natural state, but also all of the fiber that comes along with eating plants. And so high fiber foods is my next recommendation. The third one would be just making sure that you're staying hydrated, because if you're drinking enough, you're not going to have as many cravings for salt and sugar. If you're hydrated, you're going to have more energy, your body can digest its food better, and your overall body will just thank you. The fourth one is just find one thing, maybe even once a week, that you can do that's an activity that's going to actually move your body. Maybe it's dancing. Maybe it's you know, climbing. You know, maybe you go for a little hike. Maybe you just find a neighbor and go for a walk around the block. All it takes is one small step towards changing a habit. The other thing I would say is just be patient with yourself, because it really does take time to make any small change that you want to make a habit. And it really is, it takes, anywhere from, we'll say 8 to 12 weeks of doing something on either a daily or a weekly basis, however you're going to work it into your routine, to make it a habit that then it doesn't feel like such a cumbersome thing. Once it's habit, then you can set your next goal. So set a small goal, make it a habit over 3 months, and then set your next goal.
That's great.
So I think we have time for one more question, and this question I think a lot of people have some confusion about, and it basically comes down to fruit and sugar. There's diets out there that indicate that you shouldn't have any fruit because of the sugar, and so the one writer is a little confused about, do I eat fruit? Do I not eat fruit?
Right. Well, and I will say there are tons of varied and sort of fad-ish or very specific diets that will be very drastic in terms of eliminating all sugars or all carbs, all carbohydrates. There's the ketogenic diet, which, basically you're getting almost all of your calories from a protein and fat source, and then that's supposed to stimulate the metabolism to go into a fat-burning mode. But really, the most recent evidence that I've seen is that actually does not improve long-term outcomes. People who are more drastically eliminating things, I think, are more likely to then, in the end, kind of get to that point where they're like, oh my gosh, I'm never going to be able to do this, and kind of, have the long-term, we'll say, failures, or, once you return to eating something again, many times people will gain weight back. So it depends on if you're trying to follow one of the, strict, I would say, fad diets where you eliminating all sugar. And that is one way, that is one way to weight loss, for sure. If you cut out every single bit of sugar in your diet, you will lose weight, absolutely. But it's all about if that's a sustainable thing for you. And so for most people who aren't going to go that route, eating fruit is absolutely fine. If fruit is your only source of sugar, if you've eliminated your bakery goodies and your candy and your other things that have added sugar, that fruit is going to taste amazing, because that's your main, if you do get sugar, that's going to be your main way. And fruit has so many other health benefits. So there are so many ways to get information on diets out there, and just I say come at it from a healthy skeptic approach, which is there's lots of people who are trying to make money on their particular brand of diet, and anything that to me I say anything that's so drastic that a reasonable person would lift an eyebrow, that might not be one that I would wait to see what the evidence shows down the road. So that's what I would say. Hope that answered the question.
Excellent. That's awesome. Well, thank you so much, Dr. Jenkins, for joining us today. Thank you to Sarah Norton for all her work in organizing the event, our Gatehouse Wellness Specialist. And we hope to have more events soon. And team, please provide your feedback to us at ghmwellness@gatehousemedia.com. So if you have any emails, you have any thoughts, please feel free to send a note to us, and we are excited to be hosting more events down the road on various health topics. So everybody have a great rest of the day, and try to get some movement in, try to get some water in, try to get some fiber in, and it looks like we shouldn't be too afraid of fruit if we are not going to follow an extreme diet. So thanks, everybody.